So I want you to understand something before I continue what happened. So I start researching. I start doing research every single day. Every day I start reading about it. I start researching in Google, YouTube. And it is absolutely scary. It is frightening that people, they don't talk about this stuff. People, they don't know. Nobody wants to talk about it. So this is what happens when you and I, we consume carbs and sugar every day. You get type 2 diabetes, high cholesterol, hypertension, immune problems, vision problems, leaky gut syndrome. You destroy your sixth sense and you damage your liver. So by now, I'm saying, okay, so the doctors say that type 2 diabetic is a disease. High cholesterol is a disease. Hypertension is a disease. So once I start doing the research and I start researching more and more and more, I came across to this research and I start doing even more research about cholesterol. So when you go to your doctor and they do your blood work, you go back for the result. The doctor says, well, your cholesterol is very high and you need to take statin drugs to bring your cholesterol down. Otherwise, you're going to have a heart problem. You can have heart attack. You can have stroke. So let's talk about cholesterol for a minute. Cholesterol, when you go to a doctor and they do a blood work, the cholesterol is divided in few sections, but the most important section that you have to understand is that the one of them, it's called triglycerides. The second one is called HDL. The third one is called LDL. I'm not going to go through all the details because I'm not going to give you a lecture about, all these medical terms that they're using. But the most important thing, we have to understand something. So 75% of the cholesterol in your body is produced by your liver. So wait a minute. If 75% of the cholesterol is produced by your body, then high cholesterol is bad? So let's do more research. And I start doing more research about it, and then I start reading about it. So probably about 50, 60 years ago, 10 scientists, that all of the scientists that did research about cholesterol, it was paid by pharmaceutical companies. They said that the cause of heart attack and stroke is high cholesterol. And they said that there is two types of cholesterol: a good cholesterol, a bad cholesterol. So good cholesterol, HDL, bad cholesterol, LDL. So when you go to your doctor says, oh my God, your LDL is elevated, you're going to have a heart attack. So what do we have to do? Immediately, we have to put you in statin drugs to lower your LDL. Now, remember, 75% of the cholesterol is produced by your own liver. So now let's talk about a few very important things. Nobody talks about this. Your doctor doesn't tell you, because in my belief today, after 5 years, I believe that only 10% doctors, which they are chiropractors, they are real doctors, and out of the MDs, only 10% they understand what does it mean as being a doctor and heal people. Rest of them, they're ignorant people. Now, I'm not going to go off subject, but I want you to understand something. The word medicine means, listen to this very carefully, diagnose, treat, and prevent disease. I'm going to say it again. Diagnose, treat, and prevent disease. But when you go to today's doctors and you ask them, hey doc, how many people have you healed? You know what the answer is? We're not in the business of healing. We are in the business of managing disease. Oh, okay, so you're a doctor, I come to you, you come in as a god, I have to worship you because you know more than I do, because you went to the medical school, you have zero knowledge about nutrition. All you know is that if your cholesterol is high, this is the medication. If your blood pressure is high, this is the medication. If you are type 2 diabetic, this is your medication. But there is no healing. There is no end to it. All you do is you manage your disease. So now, let's go back to cholesterol for a minute. HDL, this is what happens. Your liver produces cholesterol, which is the most important thing in your body. Without cholesterol, you will die. You won't even survive for a second. So, your liver produces cholesterol for your cells. Guess what happens? Cholesterol comes out of your liver. LDL is responsible to take the cholesterol from your liver to your cells. And whatever the exceed of cholesterol remains, HDL takes the cholesterol, takes it back to the liver, and after recycling, again, LDL takes the cholesterol to your cells. So, going back to that 10 scientists, the 10 scientists that it was paid by pharmaceutical companies, they said that cholesterol causes heart attack and stroke. And by the way, LDL is bad cholesterol. There is no such a thing as a bad or good cholesterol. God created human being, earth and universe. God did not make a mistake. So 10 scientists, they're telling us that LDL, which is responsible to take the cholesterol to your cells, is a bad cholesterol. And LDL, which takes the cholesterol from your liver to your cells, is a bad cholesterol. HDL is a good cholesterol. But ironically enough, nobody talks about triglycerides, which actually, triglycerides causes the arteries to get clogged. Now, that's a very different subject. Hopefully we can make a video about that. But all you have to know for now, you could do your research. And I'm encouraging you, do your research. The triglyceride is the most vicious and the most harmful thing when it goes up in your body. So now, if you eat excessive amount of carbs, which we all do every single day, what happens? Your triglyceride in your body goes up. You get hypertension. You get high cholesterol. You get immune problems, vision problems. Because according to your doctor, the guy who wears the white coat, and you worship him as a god, it says that you have a disease. It's a type 2 diabetic. It's a disease. Hypertension is a disease. So we go back to my story for a minute. So I come home and I do a research. I do not take any of the medications. I do one thing. I stop eating carb. Completely. So now, I start taking supplements, I exercise, and I stop eating carbs. What happens? 3 months later, I go back to doctor to do another blood work. 3 months. Do you guys know why whenever you have elevated blood sugar, they said, come back in 3 months? Because every 3 months, your entire blood gets recycled. Your blood gets recycled. So what they do a test, and they say that what is your A1C, which is an average of the 3 months of your blood sugar, okay? And based on that, they determine whether or not you are normal, you are pre-diabetic, or you're diabetic. So now, eating carb causes being diabetic, and it's a disease. I go back to my doctor, and he comes to room after 3 months, and he says, oh my God, this is incredible. I've never seen such a thing. You see, I told you, if you take these medications, this is what's going to happen. I told my doctor I haven't taken any medications. He says that's not possible. Because your A1C, it's almost normal. Your triglyceride, it was 292, now it's 180. Your blood pressure is fine. Your vision is okay. Everything is fine. So what happened here? What happened? So I thought type 2 diabetic is a disease.